Mental health services is important for the overall health of every community, starting right here in Austin.
Even if everybody had insurance and had access through that insurance, they truly wouldn't have access because we do not have the providers. And that has to do with education, that has to do with getting people through the pipeline, the educational pipeline, has to do with salaries, it has to do with reimbursement. All those things have to be addressed. We've got to figure out a way to make sure that we address our budget shortfall so that we do not place this shortfall on the backs of the most vulnerable.
Key programs for people with intellectual disabilities, developmental disabilities, we can't let that happen.
That's why it's so important that come this session, starting in January, that members of the legislature hear from you directly. Hear those stories, let them know what you need, let them know what this potential budget cuts are going to mean for real people like you and like your children. That's why it's critical that you're there.
We are concerned that budget cuts at the state level would then shift costs to the local level and then put local organizations in the position of meeting needs with less dollars.
I oversee both the crisis intervention team as well as medical services. Included within medical services is, of course, the mental health services of the Travis County Jail. I would encourage everyone to do everything they can to minimize any cuts in funding towards our mental health services. The negative impact that it has on our Travis County Jail is tremendous. Varying entities can close their doors to these individuals, and we absolutely cannot.
Everybody watching this needs to stand tall and make sure your voices are heard. Visit with legislators, work through your organizations and advocacy groups so that this doesn't happen. It's really up to you.